actually attacked any wild cells in other parts of my body, whereas the radiation just treats that local area where the tumor was.
What impact did this have on you and your family, both physically and emotionally?
It was rough. It was really rough. I had 2 little boys and a husband who cared very deeply for me. And for me personally, I was more concerned about them than I was myself. I was much more worried about my children. My husband threw himself into research. He wanted to fix it. And he's not a doctor, but he did a lot of research, and honestly, he's the reason I'm with Komen now, because so much of the good research we found was through the Komen for the Cure website. My children, my oldest son was about 10 at the time, and he helped me laugh. He was making jokes. He took it seriously. He cared very deeply, but he knew I needed that laughter, and he knew how to make me laugh no matter what, so he did that. My youngest one, who was about 6 at the time, was the hardest one, because when he found out, he wouldn't look at me, he wouldn't talk to me, and for about 3 days, if I walked in the room, he'd walk out. And it broke my heart, and I didn't know how to fix that. He came home from school the 3rd day, and he threw his arms around me and gave me a huge hug and said, "Mom, I know it's going to be okay." And I was like, "What's happened?" And he had talked to his best friend at school, whose grandmother was an 18-year survivor, and all of a sudden he knew that women can survive breast cancer, because before then, we didn't know anyone who had survived cancer. And that's why it's so important to me that women talk about it, because when you know that there are, in America alone, there are over 2.5 million breast cancer survivors out there. But we don't all know who all these survivors are. And if we're not able to talk about it and share our stories, then everybody thinks you have to die from breast cancer, and you don't. So dealing with my son was the hardest part, but once we got past that, he was able to ask the questions he needed to ask. We were very open about everything we did as far as treatment decisions. It was also difficult for my family financially, because we actually lost our insurance right before my diagnosis. And we were not sure how we were going to pay for this. And one of the things that I think is very important to let people know is that there is always a way. There are a lot of different foundations out there that can help financially. There are grants. There are state and federally funded programs. So I truly believe there is always a way to get treatment. That should never be the thing that stops you from getting treatment. You do have to ask. You do have to research. And you do need help. And for me, the kind of person that I am, the hardest part of the entire thing, second to having to deal with my children, was asking for help. I'm not the kind of person that likes to ask for help, but I learned that we all need help at times in our lives. And the really cool thing is that people want to help you.
What did you do to overcome the side effects?
I was very lucky overall in my treatment. The lumpectomy was, for me, it was uncomfortable, but that recovery wasn't very difficult. Chemotherapy, I was extremely lucky. I had some mild nausea, but that was about it. A lot of women have a much, much more difficult time with it. For me, radiation was the most difficult part. I actually had some burning of the skin early on, which is very uncommon, honestly, and it made me really, really tired. What my husband did, and it was probably, he doesn't realize what a great thing this was, but he made me go for a walk every single day, no matter how lazy and how awful I felt. And he did that through chemo and radiation for me, and I honestly think that if I hadn't gotten up every day and gone for that walk, I would have been miserable. But every time we went for that walk, I came back feeling so much better, and I'd want to get up and do things and go out. So that really, I feel like that saved me emotionally.
What means of support helped you out the most?
That walk. That walk was probably the number one thing, because it got me out instead of sitting around feeling sorry for myself. And the support came from very unexpected places. There were people that I thought were my best friends, that when I got sick, I didn't hear from them at all. And it was because I think they were afraid and didn't know what to say. There were other people that I barely knew that were bringing dinners for my family and making us feel very loved. And the other main support for me, and it's still something that I draw on, is a very special group of cancer survivors. And they're all different types of cancer survivors, but it's a group that, it's a dragon boat group. And it's a group that I know is always there for me no matter what. And we don't sit around talking about cancer. It's sort of an athletic group, but we always know we're there for each other. And then the other group that for me was huge support from an educational standpoint was Komen for the Cure, because I was able to get the research information that I needed to help answer my questions.
How long was it from the first indication until you were in remission?
Well, I found that lump in January of 2000. Yes, January of 2000. I have to stop and do the math. January of 2000 is when I found the lump. I was not diagnosed until 2 years after that. I was diagnosed in November of 2002. I went through treatment for close to a year, and theoretically, with my particular cancer, that surgery may have been the thing that put me in remission and made it all go away. We don't know whether it was the surgery, which is did I say chemotherapy? I'm sorry.
No.
Okay, the surgery is the thing that probably took care of it, followed by the radiation. And so that was really 6 months. About, if you went by the surgery, it was immediate. I'm now close to 7 years out and have no signs of cancer.
Okay. Has this changed your lifestyle in any way?
My lifestyle, probably not a whole lot, because I was an active, healthy person. Emotionally, and the things that I do now, it has. Prior to cancer, I never thought about it at all. Now I want to do everything I can to help other people from having to go through it. And education is really important to me. And I have to say, as a survivor, and you probably hear this a lot, and it might sound a little cliched, but I really do have an entirely different appreciation for life. I would never ever want to wish any horrible, life-threatening disease on anybody, but it really does give you a new perspective, and it makes you very grateful for every day.
Do your family members follow the recommended guidelines for precaution and awareness?
Well, my immediate family members are all male. I have 2 sons and a husband. They are very aware. Do they get mammograms and that sort of thing? No, because it's not recommended for men. But they are very aware. They are also very active in Komen and volunteering. My mother actually routinely gets her mammograms. My sister does, and prior to my cancer diagnosis, neither of them did regularly get mammograms. So I know that my diagnosis definitely had an impact on them also.
What would you like to share with young people about your experiences, and do you have any recommendations or suggestions for them?
The most important thing is be aware of your own body. And you have to be your own advocate. If you know something is not right about your body, you ask your doctor. If your doctor tells you don't worry about it, get a second opinion, get a third opinion, get an answer. I was very lucky. I did not have that answer for 2 years. For many young women, they may well have been dead by the time they got that answer if they'd waited 2 years. I was lucky I had a slow-growing cancer. So you've got to be your own advocate. You've got to know your body. And you can't be afraid, because fear paralyzes you. If you're afraid, you're not going to get the screening you need. You're not going to get the treatment you need if you do. There's always an answer for the financial end of it, as well as the treatment end of it. And it's, ultimately, fear is the worst part. Being afraid of how you're going to handle it. But once you're in that position, you can overcome that fear and take the steps you need.
Thank you so much.
You're welcome.
I don't know of any studies right now about intraoperative radiation therapy on breast cancer. I can look into that and see what's going on. I do know, as I said before, Mammocyte has been very successful. It had to be FDA approved, and for anything to be FDA approved, it has to go through multiple phase trials to be sure that it's going to be some sort of quality of care for patients, okay? But usually the only reason why FDA approved stuff when medicine goes on is because they know that inevitably that Medicare and Medicaid are going to be billed for those procedures, and they don't want to have to pay out for it if it's not a proven method. So they want to make sure that these are going to be quality, life-preserving means of treatment for breast cancer. And as we all know, breast cancer, there's a huge push in this country and worldwide, but in this country in particular, to come up with effective, efficient, and quality of life preserving means to treat breast cancer, okay? And I'm sure every day that there are physicians around this country who are brainstorming, trying to come up with ways to increase the 5-year survival and to also increase the quality of life for women with breast cancer, and trying to find things early on and whatnot, okay? So I would say that the success rate of the brachytherapy, which as I mentioned before is in this case is Mammocyte, okay? And Mammocyte brachytherapy actually, if I'm not mistaken, it's only with the radioactive source. It's not with that little X-ray tube, which is what Zoft pushes, okay? But the Mammocyte brachytherapy has to be, I believe, with a radioactive source like iridium, which is the common source in most HDR units. HDR from brachytherapy is high dose radiation, okay? That's what it's referred to as. Mammocyte is a means of HDR, okay? HDR, high dose radiation, okay? Which means you give a high dose in a short period of time to an area in the body, okay? Question 10.
Does it work best when it's used along with surgical procedures?
Yes, it sure does. Like I said before, typically, I've known 2 people, okay, that got surgery for their breast cancer and did not get radiation or chemo, okay, and they reoccurred. All they wanted was the lumpectomy done. One is a good friend of our family up in Vermont. She had it done. She called me up. She did not get the radiation for 2 reasons. One, she heard that her tissue got burned. Her tissue would get burned if she got it, and the standard of care for radiation therapy is that you tattoo the areas of the treatment, okay? And she is Jewish, and she was very much against tattoos because during World War II the Nazis tattooed all the Jews. So she didn't want to get radiation therapy for the primary reasons that she did not want to be tattooed, and she did not want to get burned by the radiation therapy. So she only got the surgery. Within a year to a year and a half, her cancer, which never left her body, it doesn't come back, it just never left, okay? Her cancer had come back in the breast, and they had to clean it out again surgically, and then she got radiation then because she didn't want to die. But she was recommended then to get chemotherapy, and she refused the chemotherapy. So this was back in like 2000, and I can only talk to you about this because she was never my patient. She was a friend of ours. She wasn't my patient at the time. She was just a friend of ours with cancer. But I can't talk to you about my patient specifically. But what I will tell you is that every single breast that I've ever planned as a medical dosimetrist has gotten surgery first.
Okay.
Okay?
When would a patient not be a good candidate for radiation therapy?
I can't think of any reason for breast cancer.
That's
I
fine.
really can't. What makes it difficult sometimes is very large-breasted women will get severe reactions from radiation because typically the surgical bed is deep enough that we really have to pump the radiation in to get it down to the tumor bed. So if you have a woman, I'm going to draw a chest wall with a breast, okay?
Okay.
And then I'm going to draw you another chest wall with another breast, okay? And what we do is come on with the radiation, okay? And if the tumor was here, and the tumor was here, okay? You're going to have to leave the beam of radiation on for a lot longer to get through to that tumor than to get through to this tumor, okay? And what happens is the more you leave it on to get to that tumor, the more this is going to get. This is going to get the maximum amount of dose, but this is going to get the prescribed dose, but this is going to get even more dose, okay? Because you have to give, if you want to give this 100%, you're going to have to give this like 120, 130%. But that, I take care of, okay?
Okay.
And I can get it down to around somewhere between 105 and 110%, okay? But what you'll get is big hot spots, out here, but that's where you come in with IMRT, which is intensity modulated radiation therapy, which what that does is it breaks the beam down into little beamlets, okay, and allows you to block sections of the beam for just a few seconds here and there, and then it'll make all these hot spots go away. So
That's
then
cool.
I can make it all 100%, with probably like little 105s here and here. Where you don't want to be hot is out here on the outside of the breast or where the nipple is. Because the nipple is the most sensitive area on the breast, commonly. And that's where if you don't protect this area where the hot spot is, and you let the nipple get burned really bad, they can have a lot of problems with their breast the rest of their life. So even if you've cured the cancer, and that's a wonderful thing, okay? Quality of life, I mean, the woman, has to go topless all the time because if anything rubs against that or hurts her so bad that she can't think, makes her blinding white vision, then you don't want that. So what I come in is that the doctor says I want to give, 50-40, okay, 5,040 centigrade, which is a measure of radiation, to this breast, and he tells me 50-40 to that and the whole breast, and keep it cool. And then I do all that. I put the beams on. We got to be careful because over here, what do we have right next to our chest?
You got the
Lungs. Okay? You got lungs. If it's the left breast, you have the heart. Okay? You got your chest wall, your ribs, and your bones. Okay? You've got, if it's a three-field breast where you have to treat, they do have lymph node involvement, you have to treat the supraclavicular area up here above your clavicle. You've got the spinal cord here, so we have to make sure we don't treat that. So it's a lot of intricate work that has to be done for these patients to make sure that the tumor gets treated first of all, but that we preserve that breast to a quality of life that they can live with.
Okay, I think we've got another question.
All the questions? Let's do three real quick.
When does chemotherapy come into play?
Okay. Chemotherapy comes into play when the cancer is not in situ and there's concern that it has spread to the lymph node region. Then, once it's gone to the lymph node regions, okay, which they find out by doing a sentinel node biopsy and whatnot, okay, Typically what they do is they inject dye into the tumor area and then they let it run and see where it travels to, and if it goes up into the lymph nodes and whatnot, and they find that they pull the lymph nodes, they send them to pathology, and if there's cancer in there, then they, depending on how many lymph nodes have cancer, they look at it statistically and they say, okay, if it's really bad, that's when they say, okay, we need to do a mastectomy if the tumor's really bad and it's in the lymph nodes, and we got to treat the supraclab, and we have to do a posterior axilla boost. We got to boost that with radiation also. We got to make sure that all the area that cancer could have spread to gets treated with radiation, but usually they get chemo also. And the way the chemo works is that they believe that if it spreads so far, it could be anywhere in the body, which means we got to treat the whole body with a chemical agent to kill any of the cancer that could be in your body, okay? And that is why it's so important to get mammograms every year, okay? Because anyone who has a history of cancer, breast cancer, colon cancer, prostate cancer, you name it, lung cancer,
Leukemia.
yeah, I mean, lung cancer, the big thing about lung cancer, Surgeon General warning could cause lung cancer because, smoking. That, I mean, that not so much, but the big things about, breast cancer, prostate cancer, those things, if you have a history of cancers in your family, it's good to get your tests done annually as soon as you can. I mean, I wouldn't say if you're 20 years old, you go out and get prostate tests or a mammogram. But I did treat a young woman who was 27 years old with breast cancer when I lived in Vermont and I was a radiation therapist. We also have seen them younger than that. Doctor I work with, he's treated a patient much younger than that with breast cancer. Sometimes there's just anomalies, kids who are born with, problems. People can just develop problems early on in life. But chemo is used when the cancer is advanced, okay? And tamoxifen is used afterwards to mitigate hormone issues that might be feeding that cancer, okay? Because like prostate cancer can feed off the testosterone, okay? Estrogen receptor breast cancer means your tumor could be feeding off the breast cancer, the estrogen. So they, sometimes have to use hormones for the rest of their lives. Patients do after their breast cancer treatments to help mitigate any future development. Okay?
Okay.
We've been doing a lot of reading up on younger breast
Actually,
cancer,
Right.
trying
the lady that's my advisor,
Mm-hmm.
she told me that there was this one girl who came to Susan G. Komen. She was like 7, and she had breast cancer.
It's possible. I mean, if little kids can get Hodgkin's and brain tumors, and they can get Wilms tumor, which is the kidneys and stuff like that. I mean, anything. If nothing else, we can learn from medicine that nothing is outside the realms of possibility.
Right.
Okay? And what I would recommend to all women, knowing what I know and what I've learned from my wife, from her specialty is chemotherapy. Okay? She's oncology certified and I'm board certified in radiation therapy and medical dosimetry. Is that, and what most of the journals and the studies will tell you is that early detection for all cancers is your best bet at survival. And as much as Susan G. Komen is pushing for treatment standards, and they are, and there's nothing wrong with that, okay? What we really need is for women to be more, take charge of their bodies and do something early on about things. And we've seen the cure rates of breast cancer, and when we say cure rates, we mean 5-year survival, okay? The cell in a body is so infinitesimally small, you can never possibly know if you've gotten every single cell. So that's why you go for follow-ups, okay? Your best case scenario with breast cancer is a little 1 cm in situ tumor that they remove surgically, give you some radiation, send you on your way, and you do your follow-ups for the next, 3 to 5 years, and you never have cancer again, kind of thing. But if you don't pick up on that, I mean, tumor cells can be small enough that, and if they're located in the wrong spot in the breast, I don't want to say the right spot, the wrong spot, you can do self-breast exams, but if it's deep in the breast and you can't feel it and you're large breasted enough, you may never find it. And a mammogram should find it. And even some tumors are so small that they might not get picked up on mammogram, and it's not until the next year when it's maybe grown a little bit, okay? But it takes forever. The cell doubling time is the term we use. I mean, it takes years to grow a tumor 1 centimeter cubed, okay? 1 centimeter to the third power, all right? It takes a long time for that 1 cm tumor to grow, 1 cubic centimeter.
I'm interviewing today Miss Ann Poston, and she's a breast cancer survivor. Miss Poston, thanks for letting me interview you today.
You're very welcome.
I was, okay, what was your first indication that something was wrong?
I did routine breast exams, and while showering one morning, found a breast lump, and knew I needed to get it attended to because it continued to grow within a matter of 3 days.
Was there a family history of breast cancer?
I actually had no family history at all, so you can just imagine our shock and surprise when we had a biopsy that revealed it was breast cancer. Very difficult to deal with that diagnosis when you get it.
Prior to the onset of your first indicator, how did you follow the recommended precautions such as the regular mammograms, healthy diet and exercise, and checkups with your doctor?
I had always had my mammograms whenever I was scheduled to have those, and my pap smears and stuff. I think that probably I could have led a more healthy lifestyle with exercise a lot. But then there again, I think that what we have to do is just look preventatively at tests and what they can hold for us and tell us when the physicians order those. The mammograms just say so much, and I highly recommend those.
What course of diagnostics and treatment did you follow?
When I was first diagnosed, we had to have a biopsy done, and that biopsy was what actually confirmed that I did have a stage 4 breast cancer. Following that, we had to do a procedure called a right radical mastectomy. And a mastectomy is removal of the breast. That was intensive because it was actually removal of the breast, and unfortunately I had some involvement with the lymph nodes under the arm. So not only did I lose the breast, but also the lymph nodes. So it was extensive because it was from mid-chest this way and halfway my back. Recovering from the surgery was very difficult. There was a lot of things that we learned that you have to do. And of course, I had only been married a few months when we found out about this and when this occurred. So not having family local was difficult. But so we had to go through, first of all, the recovery period before I could start any treatment at all. The first treatment was that of having chemotherapy. And I actually did chemotherapy 2 different ways. I went into the office at Dr. Pavey, who was my oncologist, for what they call a small treatment, where they just actually infuse you during the day, just in the office. And then he talked with me in detail about me being admitted to the hospital to have continued chemotherapy probably every other week. But I wasn't willing to do that. I think being 35 at the time that we found my breast cancer had a lot to do with the fact that I just couldn't see myself being admitted in the hospital every other week. It was very difficult emotionally for me to do that. So I talked with him and reasoned with him to see if it would be possible for me possibly to have the chemotherapy on an outpatient basis. And he wasn't in favor of that because you get so sick with the nausea from chemotherapy. But finally, after a lot of debate back and forth, we agreed to try it. He was right, and I was wrong. You really do get sick, and I didn't anticipate how sick I would get. But luckily, they were able to give me some wonderful medication that helped with the nausea. So the first round was just the small treatment and then the large treatment. And then after we finished chemotherapy, the medication that they have to infuse, I had to go on oral chemotherapy for 5 years. So between those two, that ended the round of chemotherapy, but I also had to have radiation treatment. The radiation was a bit harder for me because during the 7th week that I was receiving the treatment, we found that I was having what they call a dermatitis, where it's actually a radiation burn. But I talked with the physicians because I just didn't know if I could continue that or not, because it's very painful. But of course they tell you that you have to get so much of the treatment, because if you don't, it's just not going to do you any good. So I had to continue that, and that was the hard part for me, because it's very painful, very, very difficult to go through. And then there again, keep in mind I was 35, so very young, and you can imagine how scared I was.
What means of support helped you the most?
I had a lot of close friends that were there, and that made it so special for me. I also joined a cancer support group called Caring and Friends, and that's made up of individual ladies that have gone through a similar experience that I went through. They've either had a lobectomy or a mastectomy. They've lost a breast through breast cancer. Some have not had reconstruction surgery, others have. But it was nice to just know that there were other people that truly had walked in my shoes and were there. And I have to say that my mother-in-law and my husband were my pillar of strength. My mother-in-law every week took me to a treatment. She was there through the good and the bad. The days that I was so sick, she was there to help me in any way she can. And I think that knowing you've got someone that you can depend on really does help you through those bad days. Because I felt like, I can get through this, I can do it. But then there were some days that I thought, well, maybe I can't, and I've got to have just a little extra nudge there. And then, of course, my faith. Without God, I don't see how people can get through this. I know that with His divine intervention, I'm here today. I think He's not through with me. And I think I'm just a miracle, because truly a stage 4 cancer patient normally doesn't survive. And I know that. So I'm thankful for all those blessings.
How long was it from the first indication until you were in remission?
I was diagnosed with the breast cancer in 1989, and then continued taking treatment through 1996, and have been cancer-free for 20 years now. So again, I just say I'm a miracle. Truly believe that.
Has this changed your lifestyle anyway?
It has. I tried to always not be around smoke earlier in my life, but now I absolutely hate to be around smoke, because I know that they say a lot of secondary smoke is a leading cause of cancer too. My diet has changed a lot. I still need more exercise in my life. I realize that not only the physical things have changed, I found that having a mastectomy also is a handicap in a lot of ways. You look very nice in your clothing, but when you don't have a breast and you have a void there, you wonder what can you do about that. So I had a big experience of learning what to do and how to fix that. So I had some lifestyle changes that I had to go through. When you think about putting on a bathing suit and getting in the pool, you really don't think about what that means. But when you've had a mastectomy and you don't have a breast, then you've got to think about wearing what's called a prosthesis. Or you think about the possibility of them reconstructing surgery to build a breast for you. But in my case, I couldn't have that. So that was an unfortunate situation. So then I was stuck as a young woman having to wear a prosthesis. And whenever you do that, if you're used to having clothing that was V-neck, you had to be real careful and sensitive with that, because remember, I've got a lot of scarring. So that was a lifestyle. Another thing that I found was a big lifestyle change for us was the fact that I believe that many times the way you prepare your food can have a big impact on cancer. And so we used to grill a lot with charcoal, and realized that that's not recommended, that's not something we should be doing. So things of that nature made a big impact too.
Do your family members follow the recommended guidelines for caution and awareness?
I have a